Diabetes mellitus. Diabetes mellitus is a group of metabolic disorders characterized by hyperglycemia, which means high blood sugar. Hyperglycemia in diabetes results from defects in insulin secretion, insulin action, or, most commonly, both. In this video, we are going to talk about type 1 and type 2 diabetes. Before discussing the pathogenesis of the two major types of diabetes, we briefly review normal insulin physiology. Insulin is produced by beta cells of the pancreas. The produced insulin is released into the bloodstream. Then insulin travels through the blood to your body's cells. It tells the cells to open up and let the glucose in. Once inside, the cells convert glucose into energy or store it to use later. Without insulin, your body can't use or store glucose for energy. Instead, the glucose stays in your blood. After this summary, we can start with a type 1 diabetes. Type 1 diabetes mellitus is an autoimmune disease caused by the selective destruction of pancreatic beta cells by T lymphocytes targeting ill-defined beta cell antigens. As you know, insulin is produced by beta cells, so decreasing in the number of beta cells lead to decreases of insulin production. Most patients with type 1 diabetes depend on exogenous insulin for survival. In type 2 diabetes, the underlying pathophysiology is insulin resistance. Insulin resistance is when cells in your muscles, fat, and liver don't respond well to insulin and can't easily take up glucose from your blood. As a result, your pancreas makes more insulin to help glucose enter your cells. As long as your pancreas can make enough insulin to overcome your cell's weak response to insulin, your blood glucose levels will stay in the healthy range. In some cases, type 2 diabetics can burn out the pancreas, thus needing insulin replacement just like type 1 diabetics. The risk of developing type 2 diabetes is correlated with age, obesity, and family history. Symptoms and signs of diabetes mellitus. Loss of insulin or insulin resistance both result in hyperglycemia. Hyperglycemia has both short-term and long-term complications. Diabetes is referred to as starvation in the midst of plenty, since despite plenty of glucose, this glucose cannot be moved into cells and utilized. Instead, this glucose stays in the blood and gets excreted by the kidneys. As you know, the amount of glucose in the blood is too high in diabetic patients. This high level of glucose makes the blood hypertonic and creates a high osmotic pressure. This osmotic pressure causes water to pass from the cells to the vascular space, so the water in the cells is reduced. The reduction of water in the cells stimulates the osmoreceptors in the brain, causing polydipsia, increased thirst. At the same time, the passage of water in the cells into the blood causes polyuria, as it increases the amount of blood filtered from the kidneys. The other major effect is activation of the ketogenic machinery. As we always say, glucose cannot enter the cell in insulin deficiency. Thus, the cells need a new source of energy production. In this case, lipase comes into play. Lipase takes it upon itself to provide the energy source that the cell lacks. But how can lipase achieve this? Lipase provides the breakdown of adipose stores. Free fatty acids occur as a result of the breakdown of adipose stores. These free fatty acids are oxidized in the liver and ketones are formed. These ketones become a new energy source for cells. However, excessive ketone production can cause ketosis. In ketosis, blood becomes too acidic, which can damage the liver, kidneys, and brain. In chronic diabetes, glucose damages the inner lining of both big and small arteries. The arteries respond by layering on plaque, a substance that fills in the arteries so that oxygen-rich blood has a hard time getting through to the eyes, kidneys, legs, and feet. That condition is called atherosclerosis, or hardening of the arteries. It can cause heart attacks, strokes, and prevent oxygen from getting to the legs and feet. When it affects the legs and feet, and sometimes arms, it is called peripheral arterial disease, also known by its initials PAD. If PAD is not treated, it can lead to gangrene and amputation. Because of its effect on the blood vessels, high blood sugar makes PAD worse and harder to treat. Diagnosis of diabetes mellitus. The main laboratory abnormality is high blood sugar. Blood glucose is normally maintained in a very narrow range, usually 70 to 120 mg per deciliter. According to the American Diabetes Association and the World Health Organization, there are two main official diagnostic criteria. 1. A fasting plasma glucose greater than or equal to 126 mg per deciliter. 2. A random plasma glucose greater than or equal to 200 mg per deciliter, with polyuria and polydipsia. Do not forget to like the video and subscribe to our YouTube channel.